It was the most humane, most gentle, most loving environment. It was like someone out in the cold who needed a blanket, and it's like the hospice care program enveloped us all, and we were finally warm.
Hospice likes to look at physical, meaning the clinical conditions that the patient is facing, side effects, things that can help improve quality of life, but we also have a focus on the psychosocial and the spiritual, which I think is the beautiful part about our model. So every patient on our program is assigned what I call the hospice triangle. They have a nurse, a social worker, and a chaplain, so we're addressing all of those needs.
A huge misconception about hospice is that I think a lot of people envision it as a facility or a building that people go to when they're really at the very end. We, in our agency, have over 800 patients, and 98% of them are home.
Hospice is a journey that always begins with what we sometimes call a difficult conversation. The treatment is not working the way we expected. The prognosis is changing and the patient is declining. So that first interaction starts with a nurse from our hospice program in our intake and referral department, and then you are led through the process from that point.
The first thing that we saw was the Northwell Hospice team take such initiative and action. Dr. Freeman spoke to the doctor, and they had a very clear conversation about, okay, he is now in the hospice program, we're bringing him home. If I showed you a week before what he was like when he was in the hospital and just failing and so uncomfortable and restless, to when we brought him home in the care of hospice, he opened his eyes and was so happy to be home.
I often say I'm like the nurse in the delivery room, except I'm on the other end of life. My role is to make sure that my patients are transitioning out of this world in a very comfortable, dignified style. And when somebody is in the home dying, it's our job to make sure they leave this world peacefully with really good symptom management and making sure the family is supported, both physically, spiritually, and emotionally.
We also, very important for families, have around-the-clock access to a nurse at any time of the day, 24 hours a day. And these are dedicated hospice nurses who work in our community. So if you call at 3 in the morning, you're gonna get a nurse that knows the staff, the program, the patients, who's gonna help triage and address those needs.
The Medicare hospice benefit is a 6-month benefit. Most of our patients are living 10 to 14 days. And unfortunately, we're seeing them in that crisis element. Whereas if we got them upstream at that 3, 4, 5 month mark, we could help them transition. We could help the family. We could answer questions. We could be a part of their journey and really get to know them, and they can trust us.
I would say thank you so much for anybody who supports the work that we do here at Northwell. We know that the monies that are raised are given to us that will help us to continue this incredible mission that we're on.
Entering hospice is a strong statement by patients that they are going to live on their own terms, and hospice is the way to do that. The way to stay home, the way to spend more time with their family rather than hospital staff, and the way to ensure that they're comfortable for the time they have left.
The calm that we felt after being in a storm of in and out of different facilities, getting different information about what may be possible, what's not possible, and then seeing the person you love the most being so uncomfortable, and then instantly entering Northwell Hospice and seeing and feeling for all of us that this was the absolute right thing to do. So that's why I want to tell my story of trying to help other people who are uncertain and afraid, because you don't have to be, because this is the right decision.